This presentation is about our research titled Health Literacy with Visual Media, a Student-Centered Approach to Well-Being. Health promotion provides a key opportunity to empower young people to make informed choices regarding health-related behaviors. Health promotion school approach moves beyond individual behavior by also aiming at whole system changes. In Brazil, since 2007, there is the Health in School program, which is an intersectoral policy between the Ministry of Education and the Ministry of Health. Working with adolescents in a healthcare context is challenging. A key issue is to overcome potential communication barriers. Our research assumption is that the use of digital technology, such as smartphones, facilitates communication with adolescents. We propose a research method that uses a student-centered approach to map their perceptions on health and well-being related issues. The goal is to foster a communication strategy mediated by digital technology that encourages health literacy and well-being curiosity in adolescents. As a result of the investigation, we expect that the findings will help to strengthen the applicability of the actions foreseen in the Health in School program. The base of the research methodology is Video Prevention Intervention Assessment, which is a qualitative research method that uses visual anthropology knowledge to collect participant-created data focusing on their experiences with health and healthcare. Months we have been working on the design of the step-by-step intervention process. We decided to use an innovative methodology based on the TV show called Everybody Hates Chris, which is an American period sitcom television series that is based around the troubled experiences of the actor as a teenager. Phases of the action research. Preparatory phase. Strengthening local collaboration. This research is part of a larger interdisciplinary project entitled The Use of Telehealth in Schools to Promote Student Well-Being, a digital health experiment in the municipality of Santo André, whose goal is to design a cyber-physical system that enables the promotion of the health of children and adolescents directly in the school environment. Due to the pandemic situation, meetings and discussions were made virtually with contributors under the supervision of this research advisor. Recruitment of students. Based on the information we got from authorized sources in the municipality, 2 middle schools in Santo André participates in the Health in School program. When ethical approval for this project is obtained, we will recruit a group of students from the same community to work together on this collaborative project. All students of Fundamental 2 with internet access will be invited to participate. Selection of equipment. At the beginning of this research, we intended to hold a donation campaign to collect used smartphones and cameras from third parties to share with the students who cannot afford one, but unfortunately due to pandemic situation we will not be able to hold such activity, so only students with electronic devices supported with video cameras will be able to participate in the project. Participatory research phase. Rapport building. We will work to build rapport and trust with the students by watching and discussing some episodes of Everyone Hates Chris, identifying and prioritizing issues. Digital storytelling uses multimedia tools to bring narratives to life that combine audio, images, and video clips to tell a story. Once determined the purpose of the digital story, it is needed to create a script and a storyboard. This will reflect what type of digital story students will make. They will then need to record their script and find media for their storyboard. The next step is to create their video, choosing a methodology. Storytelling will be explained to students. Participants will be taught how to create a storytelling short film. In order to achieve the level of greatness, participants need to work through a digital storytelling process. Training of students. Participants will be trained to make a video based on our approach. We will introduce participants to the Acme Generator, which is a great creative studio space where you can create and share moving images. Video making through shared reflection and analysis. Regular meetings with participants will be held during the research period. This cyclic process of information gathering and shared reflections acts as a means for collaborative dialogic analysis, which is used as means to explicate further understandings on issues identified and potential solutions. Dissemination of short film. Dissemination strategies are developed considering both the principle of reciprocity, that is, circling and reporting back to the community who had been involved within this filmmaking process. The concept of film festival will be followed for the dissemination, which is an organized, extended presentation of short films created by participants, wrapping up the participatory video making and dissemination process. It is important to have the time to wrap up the project and say goodbye to the participants. The last step after dissemination in a pre-organized film festival is to award the title of Best Film by votes of all participants and invited attendees. Action phase. Proposing solutions. Storytelling is the oldest form of teaching that bonded early human communities, giving children the answers to the biggest questions. Effective storytelling involves a deep understanding of human emotions, motivations, and psychology in order to truly move an audience. Participants are expected to propose relevant solutions in the field of telehealth and well-being by creating their own storytelling short films connecting students, school, and families. Creation of action teams. As this research is part of a larger interdisciplinary project, and as a continuation strategy, it is intended to use the results by other colleagues in Federal University of ABC under the supervision of this research advisor to design a cyber-physical system for promotion of children and adolescents' health. This presentation is made by Basma Jalad under the supervision of my advisor Professora Luciana Pereira and co-advisor Professor Anderson Ribeiro and is designed for Lab 3 in the post-graduation program in Engineering and Innovation Management in Federal University of ABC, Santo André, Brazil, April 2021. Our research is funded by CAPES-AMP, UFABC.